Hello everybody, this is Troy and Joe with Advanced Spine Joint Wellness. Welcome. We're getting back to our Facebook Live and YouTube informative short videos. So today we're actually going to start out by talking about sciatica. Joe, would you say this is a common topic that we see here in our office?
Absolutely. Pretty much everybody I talk to out in the community, 1 out of 3 says they have a sciatica issue. Don't know if they necessarily know exactly what a sciatica issue is, so hopefully we can clarify that for them.
Great point. So with that, here we go. So if you have sciatica, sciatica is probably 90% of what I would say we see in our office. Symptoms of sciatica. So if you're experiencing these symptoms, pain shooting into maybe the buttocks or the rear end, pain can shoot down into the hamstring, down the leg, numbness in the leg, and it doesn't have to be one, sometimes it's both. So pain can be shooting from one area to another. That's a very common symptom. With or without lower back pain. Doesn't always have to be lower back pain associated with it. And where does sciatica come from?
Lower back.
Lower back. But typically it comes from pressure on a nerve. Okay, so we've got pressure on a nerve. So if you have these symptoms, there's likely pressure on a nerve somewhere. And the pressure on the nerve can come from either the lower back area, and it can sometimes even be in the glute. People have heard of this muscle group called the piriformis. Sometimes it can be hung up there too. So that's a very common place for it to be hung up. But step one, if you do have sciatica and those kind of symptoms, step one is to first establish a diagnosis. So we have to know, where is it coming from? So, diagnosis, how do you establish the diagnosis of where exactly the problem's coming from? Sometimes weight bearing or standing x-ray is all you really need. Other times an MRI scan or maybe even a nerve study. Have you heard of a nerve study before, Joe?
A little bit, can you explain?
Yeah, nerve studies. So nerve studies, a test, it takes about 45 minutes depending on the doctor, but it tells us which nerve is injured, where, and then how badly. So it's kind of like a locator for nerve problems. If there's pressure on a nerve, that nerve study will tell us exactly where it is when perhaps the diagnosis is maybe a little ambiguous or we don't know where it is. So, so those are common symptoms. Those are things that the sciatica may be coming from, and some tests that you can do to look for it. Next thing to talk about is, well, what do you do for it?
Right.
So, in our office, again, it's 90% of what we see is sciatica. It's the most common problem that we see, and the treatment has to be focused on the problem. So obviously, we do a lot of chiropractic work in our office. We have 3 chiropractors. They are dynamite at getting pressure off of the nerve from the lower back. Spinal decompression, depending on the problem. It's not always the right answer for some of the issues, but spinal decompression is a great treatment. We do a lot of physical therapy in our office, so physical therapy. Yeah, that's right. We've got our lead physical therapist, Pierre, next week. He's going to be talking about the 3 most common stretches that you can do to help with sciatica if this is something you want to try to treat on your own. But we focus on a type of physical therapy called McKenzie. Which is very cool. That's another video that Pierre will be doing to talk in a few weeks about what is McKenzie and how does this work for these types of issues. We also do laser therapy, which is great for these problems. We have massage therapists. Sometimes trigger point injections or trigger point therapy can be helpful too. So there is a laundry list of things that can be done. So if you happen to be suffering from this issue, sciatica, this short video will give you some ideas on what are the symptoms, what are some of the common causes, what tests can be done to further identify and diagnose the issue, and what's available to treat it. Now, in some cases, the rare cases, surgery may be needed, epidural steroid injections. We always hope that's not the course. If you've been through those things, a lot of folks have been through those things and haven't maybe tried conservative things. Come give us a look and see what we can do. You can find us by going to www.ohiopain.com, or you can contact us directly. You'll probably run into Joe or John L. They can help you get scheduled. 330-721-6504.